Hi, I'm AJ Elmore, and today I'm going to be going over the basics of NPD, Narcissistic Personality Disorder. This condition has been talked about in TV shows, movies, and has even been the hot topic in the world of pop psychology. So let's get started sorting fact from fiction. NPD is a mental health condition that impacts self-image, personal relationships with others, and it affects anywhere from 0.5 to 5% of the global population. Around 75% of those diagnosed are male, but it's important to remember that oftentimes women can present differently than men do when it comes to mental health conditions. There's a lot of stigma surrounding narcissistic personality disorder, so let's set things straight. Having any personality disorder is not a character flaw. Everyone struggles with their mental health at some point or another in their lives, and for some it's a lifelong battle. No one can control whether or not they have NPD. Also, it's important to note that there's a difference between being quote-unquote narcissistic and having NPD. Just as there's a difference between experiencing anxiety and having an anxiety disorder, or feeling depressed and having major depressive disorder. So for any diagnosis, there are characteristics that need to be met to qualify for it. For NPD, you need to have at least 5 of the following characteristics. 1. Arrogance. This is a pattern of bragging, being boastful about your achievements. Number 2, envy. Constantly comparing yourself to others, wishing you had what they had. Number 3, struggling with empathy. This can mean that you struggle to care about the needs and feelings of others, and you're not really able to place yourself in someone else's shoes. 4, need for admiration. This can look like constantly seeking validation and praise from others. 5, grandiosity. This is just a fancy word for really overly hyping yourself up, exaggerating achievements, and having an inflated sense of importance. 6, sense of entitlement. Thinking that you deserve special treatment. 7, being exploitive. Because people with NPD have a sense of entitlement and can struggle with empathy, this can manifest sometimes as exploiting others. Someone with NPD may struggle to see why being manipulative is wrong. Here is a helpful graphic that the Cleveland Clinic has put out. I like how each of the characteristics has a given image to represent it. Kind of makes things more clear and concise. So what struggles come with experiencing NPD? One struggle area is interpersonal relationships. This can lead to problems within relationships, issues at work, trouble making and keeping friends. People with NPD often struggle with envy and self-doubt. They have a higher risk of suicide compared to other personality disorders as well. Also, there are subtypes of this disorder, and the vulnerable subtype can sometimes be harder to diagnose. So there's a grandiose subtype, and then there's a vulnerable subtype. The grandiose subtype presents more aggressive, boldness, overt grandiosity, while the vulnerable subtype presents with more defensiveness, hypersensitivity. The vulnerable subtype is harder to diagnose for that reason. With NPD, there is a very high presence of comorbid disorders. In other words, it's likely that someone with NPD struggles with other mental health challenges as well. Co-occurring issues can include depression, anxiety, other personality disorders, eating disorders, and substance abuse. People with NPD are more likely to struggle with an eating disorder because of their issues with self-image. We have this idea perpetuated by movies and TV that those with NPD think they are just the greatest. This is how the disorder can appear to an outsider. In reality, someone with NPD has a very unstable sense of self and struggles with insecurity to an extreme level. One of the biggest myths about NPD is that it is untreatable. This is absolutely not true. While there's no magic cure, there are many things that you can do to help make living with NPD easier. Psychotherapy can be of great help. While there's no medication specifically for NPD, anxiety and depression medications have been shown to help in some ways. Overall, when approaching treatment, these are the goals. Improving interpersonal communication skills in order to develop more intimate, pleasurable, and fulfilling relationships. Recognizing the emotions that motivate behaviors, including what makes one competitive, distrustful, or even self-hating. The goal is to teach someone how to accept responsibility, participate in an honest, open personal relationship, be able to maintain that, be able to cooperate with others. This can be coworkers, family, friends. It's also important that they get to a point where they can recognize and accept their own talents and be able to cope with criticism and setbacks, having a realistic view of their own abilities. It's important to become more skilled at understanding and regulating emotions, and also recognizing self-esteem issues, developing coping strategies to help with those. And instead of setting unrealistic goals, learning to set and accept goals that one can actually achieve. Though living with NPD can be extremely difficult, there's lots of routes that you can take to making your life easier, being able to deal with your symptoms better. And having NPD doesn't make you a bad person. It's just like anything else. We can't control the cards we are dealt in life, but we can control how we react. Thank you for taking the time to listen to me today.